When a family member suffers from a stroke, spinal cord injury, brain injury, amputation, or other debilitating impairment, it changes life forever. And sometimes, depending on the severity, that change is radical. At HealthSouth of Charleston, it's our goal to help our patients achieve their highest level of recovery. And not just on a physical level. We also take care of the social and emotional well-being of our patients. It's our comprehensive approach that helps us get our patients better, faster, regaining their independence and getting them back to their life on their terms.
They come in, they're down at the lowest point in their life, they're coming out of the hospital, and there's nowhere to go but up. And so when they start to realize, wow, this really does work, and look at what I can do now that I couldn't do a couple days ago, and the smile and the feeling that kind of happens in the room is just something you can't buy.
Opened in 1994, our 46-bed acute rehabilitation hospital provides both inpatient and outpatient services. During their stay, patients are seen by an interdisciplinary team of physicians, nurses, and therapists. This team works with the patient, their families, insurance representatives, and our staff to create individualized rehabilitation plans designed to meet their specific needs and goals.
We run team meetings every week to discuss with, therapy, nursing, the doctors. Everybody is there to discuss the patient and work with the patient to set their goals.
And the goals change every week. People meet goals. They surpass what we thought they were going to be able to do.
I felt like they were giving me personal attention, not just generic therapy. They were talking to me and finding out what I needed to do, and I appreciated that.
This thorough planning and precision execution of the daily rehab program is what allows us to return a high percentage of our patients back to the community and back to their lives. All patients are under 24-hour care by physicians, nurses, and therapists specializing in physical medicine and rehabilitation.
A typical day for a patient at HealthSouth starts very early. They're usually seen first thing in the morning by our physicians. 3 hours of therapy minimum, which would include PT, speech, OT, neuro if it's indicated. They have to work really hard. They're encouraged to be with other patients, to socialize with people who are going through similar things that they're going through. It's a really busy day. It's a full schedule.
She worked for me very, very patiently. She done a lot of good things. We took a lot of tests to see whether I was able and ready to go back into the world. And that was very good, very good. There were some days that I got a little upset. But once again, in the end, HealthSouth proved that they are good people to work with, and so from my speech therapy.
Technology utilized exclusively by HealthSouth includes autoambulator, interactive metronome, vital stim, aquatic program. Specialized inpatient programs include stroke, brain injury, spinal cord injury, orthopedics such as hip replacement, amputations. Specialized outpatient programs include day treatment, general orthopedic rehabilitation, voice and language disorders, back and spine rehabilitation, functional restoration. HealthSouth is accredited by the Joint Commission on Accreditation of Healthcare Organization, JCO, and an active participant in the Tri-County community. So you're always supported, even when you leave HealthSouth.
If it hadn't have been for HealthSouth and the nurses, the therapists, the doctors, I wouldn't be anywhere close to where I am now. I wouldn't be up walking and talking like I am. Although I'm still going through therapy and surgeries, I'm on the road back to where I'm supposed to be. So I certainly give HealthSouth the biggest majority of the credit for that.
When I had the stroke, I was not able to move, and so when I came here, I was brought as a patient and put into a bed, and they had to get me in and out of the bed, when I left HealthSouth to become an outpatient, I walked out. I was able to drive. I was able to do a lot of things that I couldn't do, and I think I owe every bit of that to what happened here. The speech therapist, the physical therapist, the occupational therapist, everybody at HealthSouth just kind of helped me. It was like a team working together to get me out of here and back to living life, normal again. And now I'm living life normal again.
So when you or one of your loved ones needs the best in physical rehabilitative care, call HealthSouth of Charleston and learn to live without limits.